Ladies and gentlemen, good morning. Good to see you today in Berlin for the World Health Summit. Beautiful Sunday, but you are all here for a key issue. This key issue is to be able to speak all together, one voice, for a European global health and One Health strategy. So the objective of this workshop is to discuss the necessity to adapt and strengthen European global health strategy to better align with health priorities and the SDGs while stimulating innovation in global cooperation. The updated EU global health strategy should enable an integrated and complementary policymaking by EU member states and multilateral organizations like WHO. The new EU global health strategy should also outline how it will be establish equitable partnership with non-European stakeholders, with particular care to the global south. A post-COVID Europe must be focused on One Health for all and must speak with one voice on global governance for health. I'm the Secretary General of the One Sustainable Health for All Foundation, and we have started last year a forum, One Sustainable Health Forum, to make together One Health and the SDGs, with Detlef Ganten, the World Health Summit, and many partners. And we have decided, at the occasion of the EU French Presidency, to set up an event in Lyon. It was in February, and to work all together, I would say the professional civil society, on consolidated recommendation. And we have been invited on February 10 in Grenoble, the city of our former health minister, with Ole Peter, and as a delegate of this civil society group, we are invited to speak about these principles, what made the declaration, the Lyon Declaration, by the way. And after a few months, we decided that we have to follow up. And thanks to Alena, we are now planning an event in Prague on November 30th. So just to inform you about this platform, this coalition, One Europe for Global Health. The goal is to improve and integrate global health and One Health priorities into European policies, strategies, and actions by engaging European civil society and convening actors from all sectors. We have a common responsibility all together, private and public, and we need to take responsibility. So the One Europe for Global Health Coalition stems from the Lyon Consolidated Declaration for European Health Union. And the principles outlined in the declaration are to make a long-term commitment now for future generations to act locally while thinking globally, come together in equity and solidarity, limit silos with more intersectoral cooperation, and commit to good governance for European Health Union. So this workshop will be followed by a high-level side event tomorrow, tomorrow at 2 p.m. But now we are going to start, and I will invite first Rhoda Wayenze. She is the Dean of Makerere University School of Public Health in Uganda, to explain the global status of the One Health and Global Health convergence. So Rhoda, please, if you could come. So 3-4 minutes to explain you.
Thank you, Benoit, and a good morning to you all, ladies and gentlemen. I appreciate the opportunity to share my perspectives and especially to also shine a lens on the issues from the Global South, particularly in Africa. And to begin with, there's no doubt to all of us here that the challenges that we've just gone through with the COVID-19 pandemic and all the other crises that we face, whether it's the climate and microbial resistance and many other issues, bring forth all the evidence that we need to know that it's not just about health, but we need to go beyond health sector to be able to deal with issues of healthier lives. And that is taking us to the entire ecosystem, the animals, our environment, and whatever is within it in the concept of One Health. And there's no doubt that we need to go beyond the traditional boundaries to be able to work together in a multidisciplinary way, in a holistic manner that also goes to the root cause of the issues, as we know the health determinants to be, and that we need to work together with the public, private, as well as academia, research, and others. And this must transcend geographies and continents. And with the magnitude of the issues we are facing today, there is also no doubt that we cannot have a one European health without global health, and we cannot have this without One Health. So we need to ensure that these issues are integrated. But one thing I would like to emphasize is that One Health, one global health, and one European health does not mean that everything is the same, that the world has differences, that we have different challenges and different priorities in some of our settings. For example, we have been grappling with COVID, all of us, and right now the priority globally is to scale up vaccination for COVID. Very welcome, but we have lost so many children, so many more mothers to other conditions other than COVID. And some of these priorities have been de-emphasized over the past 2 years. So a One Health and one global health does not mean that one size will fit it all. We need to look at these conditions. We still have neglected tropical diseases in Africa, and I hope we can remove that name, neglected, because we choose to neglect and we can choose not to neglect. Then we also have the emerging burden of non-communicable diseases, with our systems not really prepared to struggle with the dual infectious and non-communicable diseases. And we need to do something to deal with the critical health determinants because our system cannot hold. And I also need to emphasize that for us in Africa, sub-Saharan Africa alone reports more than 100 disease outbreaks a year. So even as we were going through COVID, for us in Uganda, we had so many other disease outbreaks. We had anthrax twice. We now have Ebola. DRC has been having Ebola for the last 2 years. So we need something that is broader, that's and that is more relevant to our local context. And two other issues I would like to emphasize around this is we need to really invest in data, local epidemiological data to drive actions, because we cannot know what is local and that what we must focus on unless we invest in data and the systems to analyze it and move it to action. So we need to be able to invest in that. And then we need to let the data speak and direct us in terms of where we go. So local also means local data, local research, local innovations, and locally driven, but with a global perspective. I also need to mention the issue of inequities. Inequities is a big problem. Whereas we would like to work within the entire SDG framework to be able to address the health determinants, we need to pay special attention to SDG 10, inequalities which cut across health, it cuts across determinants of health, access to education, access to technology, and skills for us to be able to participate fully in the ecosystem for research and innovations. We need to address equity in all those aspects. And I also need to say that inequities also affect our partnerships. So as we speak about collaboration across sectors, across geographies, we have to pay attention to the issue of equitable partnerships so that everybody can bring their mind to bear, because inequities do affect a generation of solutions and innovations. So we need to make sure that as we speak about the one global health, as we speak about the One Health, we have mechanisms to ensure that we deal with inequities within partnerships. And finally, let's not leave education behind. one of the issues that gets sometimes frustrating for us is we invest so much in changing global policies. We invest so much in programs. We don't invest in reorienting our education system. So we continue to produce what we produced yesterday for today's challenges. We need to pay attention to education, research, and innovations. And we need to remember that education does not give immediate results. Like within 1 year, I'll give you the results. That sometimes is not the case, that we must be prepared to invest long-term to make sure that we reorient this system so that we can produce future change makers, future leaders for a sustainable One Health. Thank you so much for the opportunity to share these perspectives.
Thank you, Rhoda. Now, Ole Peter is going to speak about the paradox, but Rhoda, you mentioned the SDG 17 somehow, about the new partnership at the end of the speech, and to take into account the more relevant local context, especially. So, Ole Peter, I would say that you are a strong pillar of this initiative with Detlev, and you are used to talk about 3 paradoxes. Can you mention?
Yes. We will get back to that. So it's great to be here, and fantastic to see that the hall is too small. That bodes well for the future of this initiative. So I think Rhoda captured it all. It's about health for all. Exactly what the prize, the Virchow Prize for Global Health, was all about yesterday. I hope that you enjoyed the ceremony. For the first time, the Virchow Foundation has awarded a prize within the field of global health. So that was a good prelude to today's meeting. So what is Lyon Declaration all about? Well, it is all about putting health center stage. As Rhoda said, exploiting, utilizing the momentum that was given to us through the COVID-19 pandemic. We must use this momentum now to bring health center stage in Europe and worldwide. And there are 4 C's that I think encompasses what this initiative is all about. The first one is certainly cooperation. But the key is not only cooperation within Europe, but also with the world beyond. We need the global perspective that Rhoda was talking about. And within the cooperation concept, of course, comes the key issues that we need equity and we need equitable, equal partnerships in our collaboration and cooperation. What we don't need is that different continents, different regions move in the direction of self-reliance and self-sufficiency in a world where we know that we are all interconnected. Then comes the second C. In addition to cooperation, we need convergence. What we see in Europe today, I think, is that there are priorities that are not really connected, not really converging on what is the major issue, health. We have a green transition strategy. Climate changes, of course, need to be coupled to health issues. We have a digital transition, as Rhoda said. Data, that's also all about health. So we have to put EU's priorities in the context of health. The next C is, in fact, context, but in a different shape. We know that health, human health, is intertwined with the health of animals, with the health of our planet, and we have to ensure that the policies in the time to come really take this interrelationship duly into account. So that's the third C. And the fourth C is perhaps the most challenging one. We know that it's not a matter of governance of health. That's the easy thing. The difficult thing is governance for health, the cross-sectoral approach. We know that health is impacted, but also generated in all sectors in society. So to have a governance system that takes this into account is essential. So these are the 4 C's: cooperation, also beyond Europe, convergence, context, and a cross-sectoral, interdisciplinary approach to health. But there is an additional C that I think will be an issue for discussion today, and that is continuity. And I'm very happy to see, in fact, representatives for 3 presidencies here now. Alena, we will follow up in Prague. That's a Czech presidency. Anders Nordström, you will be presenting the plans for the Swedish presidency starting the 1st of January. And we also have representatives here from the French presidency, where it all started with Stéphanie Saïdou now being the Global Health Ambassador for France. So continuity is of importance. And as I said, the attendance here bodes well for this continuity. Thank you very much for your attention.
Thank you, Peter. So now we are going to hear Karine Sipido, professor at the Lyon University, specialist of Europe. So Karine, could you tell us what has changed? Who is in charge of what? And also what is needed? 3 questions.
Yes. Thank you very much, Benoit. Can I have my slide presentation, please? Thank you very much. I'm very happy to be here. I am not that much a specialist as Benoit says, but let's say I have been involved in one aspect that we also feel is very important in this discussion, and that is health research. Health research is part of coming to this public and global health approach. And for a number of years, I have been working with several people here in the room, among whom Detlef Ganten, as the expert advisory group to the Commission, the Scientific Panel for Health. And I'm going to bring some of the concepts that we developed there and talk about health research. Is it fit for purpose when we talk about going towards global health? So if you look at the competences in Europe, and Dr. John Ryan will certainly elaborate on that much more than I can, but health in European treaties is not a main competence. It is a competence in the sense that Europe engages itself for a protection, a high level of human health protection, but the competence is shared with member states, and member states are in charge of their own national health services and medical care, and the EU is complementing those activities. Now, there have been a lot of ways that the EU is supporting this, and you will hear about that. But the consequence is that in terms of financial support, it has been small. Where the EU has been very important is, for example, in setting up the agencies, the European Medicines Agency, the European Center for Disease and Control, ECDC, and those are outside in the sense they are externalized agencies. But the budget to health itself has always been rather modest. On the other hand, research has been a main competence. And so health research has been supported through consecutive framework programs, but has also in the spirit of Europe been directed towards innovation. So if we now look at the content of the health research programs in the EU multi-annual framework, so every 7 years, broad priorities are set and instruments are developed to implement that program, that priority, then you see here, and I'm sorry, but I cannot point them out to you, but you will see there are many instruments, and they're all mostly good instruments that deliver on their specific purpose, but there is a level of fragmentation that cannot be denied. And that fragmentation also extends to the funding, because although there is a lot of funding at EU level, most of the funding for health research sits within member states. And that is what is shown on the right hand of this slide, where you see 1.3 billion euros spent in 2020 by the EU, but 19 billion in member states. And those numbers also reflect the high investment in these COVID years, where much initiatives came from member states, but lacking actually that power that comes from collaborative research, where the EU has the main entry point to fund collaborative research, which we need so much. And it comes close to the sea of cooperation, where I will come back to. This is my last data slide, but it's important to understand also how Europe stands in the world. And if you look at the EU funding is on the left-hand side of your slide is a spending in 2019. You see that NIH has a comprehensive spending in the US. So it sits across the whole of the US and spends much, much more as a single funding agency, whereas the EU spends its part of Europe, but is complemented with, for example, spending by Germany in the DFG, INSERM in France, but then you also see the spending in Canada, in Japan, Australia that have dedicated health research programs. Many European countries do not have a dedicated health research. A few are very powerful in that respect. I don't have time to go into that. Another way of looking at health research spending in the world is to look at the output. And there you see on the second line of the output, a player we haven't talked about, which is China. China is investing a lot into health research. It is taking part in clinical trials, and we have to bring in China also in this discussion. So who sets then the priorities strategically? What are the global health partnerships in all of this? EU has its program, the EDCTP, and you will hear more about that and the global health strategy. If you look at the budget spent there on an annual basis, it is around 100 million. 100 million that needs to be partnered by the participating countries and industry to come to a global budget that is double of this. NIH invests about the same. And then there's a lot of private foundations that step in that should also be part of the discussion. So I'm going to end here and come back to at least two of the C's that Ole Peter mentioned. They are cooperation and convergence. If we want to have a European health union that is able to speak at global level, it needs to have a good governance inside the EU. It needs to have a comprehensive health research strategy that leverage all the components that are available to Europe, and it needs strong leadership. At the moment, this is also fragmented. Who speaks for health in Europe? Who speaks for health research in Europe? If you think of the USA, you know of immediately who is in charge of NIH. These are highly credentialed leaders. We need a similar leadership. And the Scientific Panel for Health proposed a number of years ago to set up in research, at least, a European Council for Health Research. Important in that is the cooperation with multi-stakeholders platform. We need everyone on board in this cooperation. And then that should evolve into a European Health Union leadership that can talk to the world. And I'm going to stop here. Thank you very much.
Thank you very much. Thank you very much, Karin. It was very clear. And I'm sure that Michel Kajakshin is going to react and maybe to propose some ways to go further. Michel, you are going to speak on behalf of Santé Mondiale 2030.
Yeah, thank you, Benoit. Good morning, everyone. I'm not going to follow up on research, actually, but bring some contextual remarks. And indeed, on behalf of Santé Mondiale 2030, which is an independent French think tank that, if I'm not mistaken, has been part of the One Europe for Global Health Coalition from its inception. I'd like to make 3 points. The first is about the timeliness of the new EU Global Health Strategy that we have been strongly advocating for. As Ole Peter said, we are learning lessons from COVID. And what is clear, and I'd like to emphasize here, is that I feel we're in times of opportunities to move politically on global health, because the COVID pandemic has really brought forward the true geopolitical dimension of health and of global health. At global level, What we have seen is health, which was a sort of soft power agenda, move to critical economic and to becoming a critical economic and security issue. And health took up large parts of major deliberations of the G7, G20, WTO ministerial meetings, as well as many regional fora. And as we discussed in a meeting that Anders and I were attending a few minutes ago, there will be 3 high-level meetings at the UN General Assembly around global health next year, 2023. So shift from soft power to major security and economic issue. Second, at the European level, health was always something of lesser consideration of the Union. As you said, Karin, with member states guarding their own competence, I would say jealously guarding their own competence. But now we've seen that COVID-19 moved us to have council decisions, to have HERA, to have joint trans-border action and essential functions. And I guess this will likely result in treaty changes sometimes, I hope relatively soon. But as we build a coherent internal European agenda on health, we also need an external agenda on health of a Europe, as you said, Benoit, in your introduction, speaking one voice in global health in the multilateral diplomatic arena. And here the global strategy is the right instrument. We want it to be based on Europe's values of solidarity, support to resilient health systems, commitment to equity, inclusiveness, multilateralism, and commitment to sustainable development, of which, of course, the One Health approach is a key element. My second point is precisely on One Health. No doubt that prevention, preparedness, and control of future outbreaks and pandemics will be a component of the new strategy. What is unclear, I think, to many of us is how to implement the One Health approach and which priorities to invest in. Because if you think of preventing spillovers from animals to humans, this is a huge field, yes? That goes from vaccination, managing animal husbandry, limiting human-wildlife interactions, better forestry management. It's a multi-tens of billions of investment. And then even with major investments in prevention, we're unlikely to eliminate spillover events soon. We therefore need to come together and focus on some priorities, interventions that would have the greatest impact in a tight timeline. And just for the sake of the discussion, and there's no time to say why, but let me just put on the table for the discussion 3 areas that I think Europe could invest in One Health. One is clearly antimicrobial resistance. The second is investing in enhanced One Health surveillance system across the European continent and with bringing our contribution to enhanced surveys across the world. This was one of the major points that came out of the review of the IPPPR, of which Anders and I were members. And then the third would be to refocus Europe's cooperation investments in research, in capacity building, in emerging infectious disease hotspot countries. And we know where they are. They're not in Europe, actually. They're in West, Central, Eastern Africa, Southeast Asia, China, and India. My last point is that drafting a new European strategy is one step. It's fine. But I really think, as we have been advocating with Santé 2030, and France has been advocating during its presidency, we need also a joint European action. We need that funding to develop global health capacities in member states across Europe and increasing the coordination that Ole Peter mentioned among EU countries on global health. So here I look at you, Elena. I look at you, Anders, of course. I hope it's not too late that the Czech and Swedish presidencies revive this idea of launching a joint, of requesting, submitting to the EC a request for a joint action that, as I said, many academic and political fora have been promoting during this year, 2022. Thank you.
Thank you, Michel. Thank you, Michel. It was great to hear you due to your strong experience for years and to hear about the recommendation. I will invite Clemens Sauer, President of the Global Health Forum Gastein. We were together 2 weeks ago in the Gastein. You have invited Sandra Gallina among your speakers, and we were discussing this issue about global health and One Health. And I would say, I need to say, to remind that when we started this coalition, One Europe for Global Health in Lyon, we started first with the experience of the Gastein, with Dorley, your Secretary General, and especially the manifesto. So let's talk about it. Thank you.
Thank you very much for the kind and friendly introduction. I would like to make 3 points with 3 different heads. As the president of the European Health Forum, I have a déjà vu, because 20 years ago, we already talked about a global strategy for the European Union, a global health strategy. Back then it was Commissioner Burns, and he presented it the first time at the European Health Forum. So for me, it's a déjà vu. You know, it faded out and then disappeared totally from the European health agenda. But now there's a revival. Isn't that good? I'm very optimistic. I'm very positive. So my first, that was my remark as European Health Forum. My second remark is as a former member and vice chair of the executive board. You know, friends, in Europe, we sometimes forget that the European Union, and with the European Union, I mean the European Commission together with the 27 member states. The European Union is a global player when it comes to global health. But we forget about it. Our host country here right now is the single largest contributor, I don't want to say donor, to global health programs, at least to the WHO. Why is that? Because we in the European Union, we still, and the most member states, I can't speak about all member states, but most member states are still believe in multilateralism. And we want to strengthen multilateralism. Therefore, we are behind all this. So Germany, once again, one of the single largest contributor donors, etc. You know, it was under my time, so to say, in the executive board, that it was the European Union who pushed for a new financial framework for the World Health Organization. There was resistance from our American brothers and sisters. There was long resistance from Brazil and other major players, but it was the European Union who pushed it through at the last World Health Assembly. The same is true by many other governance reforms we took, you know, especially when it comes to preparedness, response, and prevention of public health catastrophes. So, and there wouldn't be an intergovernmental negotiation process to come up with a new legally binding instrument for better prevention and preparedness if the European Union wouldn't have pushed it through also at the World Health Assembly. So what I want to say is, you know, we are a strong player and we are very much committed. And, you know, since I also was involved in the joint procurement for the European Union for the COVID vaccines, I can tell you the already difficult situation of COVAX would have been a total disaster if the European Union wouldn't have supported it strongly, the Commission and the member states. I have to be honest here, but you know, this is the strength of the European Union, and please, let's think about it. My third remark is as a national from Austria. I'm very happy that we do this now together, this global strategy thinking of global health strategy, because, you know, it was almost all the time the forums of G7 and G20, and nothing, France and Germany and all the other friends who are participating in G7 and G20 are doing a wonderful job in doing it. But strategically, and I would like to make that point politically, strategically, it's so important that all the member states of the European Union can be part of these discussions now. Because Austria, Sweden is always a little bit better because you are very much involved in global thinking and global action. But many, many other member states, and I definitely can speak about my member state, we are not taking actively part in this kind of discussions. So this is good because at the end, and I would like to close with this, as a European, and I say this to my non-European sisters and brothers here also at the podium, but also in the room. At the end, it is about overcoming a mentality in Europe that, and this is the mentality when we talk about global health and global strategy, we are talking about charity all the time. But no, it's not about charity. It's about empowerment. And together we can really provide this new notion that it is empowerment and overcome this charity notion, which is fine, but it's not enough because once again, it's about empowerment and that means investment, investment, investment. Thank you very much.
Thank you very much. Thank you, Clemens. It was very clear and I saw you reacting, Elia Molina Milman, you were saying yes. So it's a good transition. You're a member of the Congress Health Commission in Chile. So from your perspective, what does it mean?
Thank you. Good morning, everybody. I'm going to read to optimize my 4 minutes. Well, as a former Minister of Health and actual member of the Health Commission Chamber of Deputies at the National Congress of Chile and coming from the Latin American and Caribbean region, I want to thank the organizer for inviting me and for the opportunity to contribute to discussing and strengthening the European global health strategy to better align with Latin American and Caribbean countries in One Health priorities and SDGs. Our region is facing multiple and important challenges. We cannot grow with high productivity, global competitiveness, and social inclusion if our population cannot access quality health care. This is what we mean when we talk about the inefficiency of inequality. We propose to work collaboratively and integrally on the following 5 priorities with the European Union. First, health systems. One important priority is the improvement of health systems to achieve universal health coverage and leave no one behind. Tackle health inequality and ensure social protection in health as a right, with universal health system based in a strong primary health care. Non-communicable disease, as well as all the diseases along all the life cycle, is part important of our agenda of including sexual and reproductive health disabilities too. Europe has already gone through to an advanced demographic and epidemiological transition, and lessons learned and good practices must be shared in our region. Second, gap in research and innovation. We receive a lot of information today, very interesting. Innovation and availability of quality assured health technologies, pharmaceutical and medical device, medicine and vaccines. We need to find a more effective way to use existing flexibilities to trade-related aspects of intellectual property rights. Third, addressing health inequities and social determinants of health. Equality must be considered one of the drivers of regional development and a strategy for closing structural gaps in terms of income, capacities, productivity, and access to public goods. We propose to discuss our model of economic development. A priority is addressing health inequities and a social, economical, and environmental determinant of health through right-based approach and health in all policies, considering gender inequity. Fourth, environmental factor and climate change, an increasing policy coherence between health-related and climate change-related initiatives. New mechanisms must be incorporated to facilitate access to financing
of sustainable investment, considering global environmental problems, we need to address global health in its response to climate change together. Nutrition security will be increasingly threatened by climate change, and populations suffering from malnutrition are more vulnerable to the growing threat of disease outbreaks. Finally, a strong leadership in global health diplomacy and better global governance is needed. The COVID-19 pandemic has highlighted the necessity of strong leadership in global health. We need to strengthen multilateralism and advance the Agenda 2030 goals, and this new global strategy is an excellent opportunity to strengthen partnership with the Global South as equitable partners and to improve healthcare beyond European borders. As a closing remark, the COVID-19 pandemic has a high human cost and a heavy economic impact in our region. It has reserved decades of progress, deepened inequalities, and added to the challenges of other pandemic diseases and those of climate change. This is a global challenge. No country, no region, no continent can face it alone. At this time, the European Union and Latin America and Caribbean must strengthen their strategic partnership to move towards a more sustainable, inclusive, and equal world. Thank you.
Thank you, Elia. We see clearly the link in health, global health, between all the countries. And I hope Alena will give you answers, because she will welcome us in Prague in November 30th. So Alena, you are going to speak on behalf of the Czech Medical Association, and especially your country is having now the presidency of the EU. So what is underway?
Yes, fine. Dear Benoit and dear colleagues, firstly, thank you for giving me the floor and the opportunity to speak how the Czech presidency could really contribute to this whole process. Let me say that if we want to adopt some unified European strategy, we need to negotiate it and speak about that. And it's going on. And I would like to thank also the organizer for arranging such an event, public event, when we can talk about that. So French colleagues initiated the whole process under the French presidency. And on my behalf, I am very glad that the Czech presidency, let's say, or the presidency belongs to the Czech Republic in this moment, and started already in July, and it runs until the end of December. And there is still time which can be used for continuous effort, and really use all these activities so that Czech presidency can provide platforms for an open discussion. Of course, the meetings which have been already planned under the Czech presidency have very clear thematic goals and objectives, of course, very much related to the main health European issues. But there is still space to let's say, benefit from all these gatherings for formal or less formal, let's say, exchange of experience, consultation, calibration of opinions. And it doesn't matter if it's the meetings or higher level participation or expert level. I would like maybe give us some example. There were already adopted the Prague Declaration on synergies in the research and innovation funding in Europe. And I think that this declaration very well fit with the global relevance and also with Lyon Declaration. And maybe that it's also some answer to what Karin said about the fragmentation in the research area. And again, Lyon Declaration maybe mentioned it already in its preamble or its some articles also. So how the Czech stakeholders were involved to some events and activities under French presidency. We also, let's say, intend to cooperate very closely with Swedish colleagues and, let's say, help with the design proposed of joint action on global health, which will be really in the hands of Swedish colleagues. We are very also committed to cooperate closely with the European Commission on the communication on global health. And additionally, the Czech Republic is currently voted as a member of the Standing Committee of the Regional European WHO Office. And therefore, we can liaise, or I even personally can promise that the strategy will be also in line with directions and objectives of this international organization, very important under the UN system. And moreover, the Czech Republic every time very fully support the communication and coordination between Brussels and Geneva, and as well as between the regional office in Copenhagen. Just let me also remind maybe the already mentioned concept of some diversities, because I feel that it's maybe the most important for the whole process. And that we all really must build bridges and not trenches between states. However, we are aware of this European diversity among European countries, and it's many aspects regarding of maybe the conditions of the level of healthcare delivery system, of the economical development, some political positions, and of course, these political positions are probably the most important because they are built over years, over decades, and sometimes over centuries. And these attitudes are given by some historical context and geopolitical conditions. And we know how it is difficult to change some standards, some norms, and even the culture of these countries. However, recently, the situation is more critical than ever before in our modern history, and we need this balance of opinions and maybe even the changes of these attitudes and relations between countries. I think that it means that speaking with one voice is probably only the solution which we have on our hands at this moment. Thank you.
No.
Thank you, Elena. I'm going to invite John Ryan. You are the Deputy Director General of Health and Food Safety at the EU Commission. So diversity, working together. So this coalition is made of civil society professionals, and we work with governments and also with the Commission. So we are going to hear your advices and what is underway. Thank you.
Thank you very much. Thank you for the invitation here this morning. I'd like to say a few words from the EU perspective and begin perhaps with the internal EU policies and then make the link with the global health strategy. So first of all, the One Health approach is not a new concept within European Union policies for health, but I would say it has its high tides and its low tides. And as Clement was saying earlier on, it seems to come and go at different times. At the moment, we're at a high tide period because, of course, of COVID and the links with suspected origins of the outbreak. But we're also in the middle of a potential outbreak in Africa of Ebola. We have the more silent pandemic. We have Zika, of course, and coronavirus, all of which underline the links between different sources of outbreaks which can affect human health. And the link between human, animal, and plant health is really a key point, which seems, as I say, to come and go in policymakers' minds. At the moment, it's very much in the center of our attention. The Commission supports the definition which was agreed in 2021 on an integrated unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. This was the definition agreed on One Health, and I think it's important to have a common understanding of what we mean by One Health, because some of the presentations I've heard here this morning raised the idea in my mind that there might be a different concept being discussed by some people, which is the issue of health in all policies. And I'd like to come back to that point later on, if you don't mind. So from the point of view of antimicrobial resistance, I would mention that this is an area where the European Union has tried to align its legislative approaches, whether it's for animal health, the use of pharmaceuticals, and in human health, taking account of a point that was also mentioned earlier on, which is that our legal powers are different in each policy area. So for human health, curiously, for human health, the majority of the responsibility remains with the member states, whereas for animal health or plant health or pharmaceuticals, for example, the responsibility and the competence is at the European Union level. And this sometimes strange legal situation can explain a situation on the ground that the human, the response to antimicrobial resistance for human health is different in scale and nature to the measures we can take for pharmaceuticals or for animal health. And I think if you don't understand the legal background, it's difficult to understand the policy difference that we have in Europe. We're trying to overcome this with a more balanced and rational approach, looking across the antimicrobial resistance concept in a much more integrated way. One of the ways we're doing this in a concrete way is integrated surveillance, and therefore setting up surveillance systems which speak to each other, which is of course much easier if you have digital Europe and digital health. You can have data systems which speak to each other and don't operate in a silo setting. A second approach has been taken in the European Health Union. European Health Union is a series of legal proposals that we're in the process of adopting following the COVID outbreak, really a strengthening of our agencies and a strengthening of our legislation on cross-border threats, which we hope will also lead to a better capacity to detect and respond to issues like antimicrobial resistance or other zoonotic threats. Integrated response, I think, is also important so that the committees of member states who are dealing with outbreaks speak to each other. And we had experience in the past with pandemic flu, but also with other salmonella outbreaks, for example, where different committees actually sit together in order to make sure that the veterinary side or the food safety side are speaking with the human health side in real time. But it goes beyond that, I think, since we do have very strong legislative powers on things like, for example, soil health, biodiversity, animal welfare, pesticide use, all of these other topics, I think, show that a One Health approach should really try and involve all these different legislative areas. And I'd mention in particular here the pharmaceutical reform, which we're undertaking at the moment, which is aimed at reforming our pharmaceutical legislation. And there again, we're trying to integrate, for instance, the environmental aspect in the pharma legislation to try and take account of the impacts of the pharma industry on the environment. Another example might be in the area of climate change, where we've established an observatory linking health data with climate and environmental data. And I think that's also important to have that joined up approach when we come to preventative measures in respect of climate change, heat problems in the future, perhaps, and also environmental disasters of different types, as we see every year, are increasing in size. Now, operationalizing this multi-sectorial approach is quite complex because the legislation is very often adopted at different times or revised at different times. So you're basically trying to catch up on a situation where you have, for example, the pharmaceutical legislation in Europe, I think, is 60 years old at the moment. So you might say, 60 years is probably time that we revised our legislation. For the health threats, as I said, we're revising it at the moment, taking account of the last outbreak of COVID. So this also explains a little bit the catch-up situation we're often in trying to adapt the policies to our latest knowledge. Mention was made of research, and there again, I think it's important that we have a forward-looking research agenda and not a backward-looking one. So very often it's important when we do adopt our new research programs every 7 years that we look far into the future, as far into the future as we can, to try and identify future problems rather than linking our research to today's issues. And if I might now say a few words about the Health in All Policies approach. Health in All Policies approach at the European Union level involves things like the reform of the Common Agricultural Policy, which we're going through at the moment. In other words, how to make sure that the subventions and the support which we're giving to agricultural production is somehow linked to a health agenda. And a concrete example of this would be the issue of red meat. The use of dairy products. How do you encourage a common agricultural that's more health friendly, I would say? Second example would be the Farm to Fork initiative, which sort of follows the same approach, making sure that our support for food sustainability is linked also to a health agenda. And third example I might give is on digital health, where there's a clear need to upgrade our health systems to take account of new digital tools that exist. Now, can't say a great deal about the global health strategy at the moment because it hasn't been adopted. It's in the process of being agreed as we speak. But basically, the global health strategy will try and make a link between the SDGs, the international needs in global health, and our domestic policy. So we'll be really trying to link the developments in Europe in these different policies which can affect health with cooperation on a global level. And we do hope that this will also be a renewal of our commitment to multilateralism, because one of the big commitments of the von der Leyen Commission was to renew our interest in and support for a multilateral approach. Thank you very much.
Thank you very much, John. So we are going to follow this process. And now I'm going to invite Florence Torrer-Jones, Advocacy Officer at DSW. So we represent an NGO that are part of the coalition. And you especially talk about the human rights, also health and human rights.
Thanks. Yes, I'll be talking about the need to connect advocacy efforts to policy, and we'll focus my intervention today on the EU's new global health strategy and, most importantly, its implementation. So the EU's current framework dates back to 2020, and DSW, as part of a coalition of global health CSOs, has been advocating for its renewal. The framework is evidently outdated, with some crucial areas such as antimicrobial resistance, sexual and reproductive health and rights, and pandemic preparedness largely absent or insufficiently addressed. Moreover, and crucial for this discussion, is that the 2020 framework was not truly a strategy. With no targets, monitoring framework, or dedicated budget, it is impossible to evaluate its implementation and impact. DSW is thus pleased to see the EU renewing its strategy in consultation with a broad variety of stakeholders, including, importantly, from low and middle income countries. Today, I'd like to discuss three considerations that we at DSW believe are key for the success of the strategy: connecting advocacy with policy, policy with impact. So first of all, the global health strategy, to be truly transformative, must adopt a One Health approach. Across the world, the climate crisis is having a significant impact on people's health, including sexual and reproductive health and rights, with women and girls in all their diversity disproportionately affected. Changing weather patterns are also threatening the re-emergence or exacerbation of epidemics and infectious diseases. And similarly, AMR, including antibiotic, antiviral, antifungal, and antiparasitic resistance, often referred to as a silent pandemic, threatens progress made in tackling major health challenges. With limited tools available for diseases including HIV, malaria, and TB, a leading cause of AMR-related deaths, research and developments for new and improved tools is urgent. These examples clearly indicate the necessity of having a global health strategy embedded in a One Health approach. Secondly, policies alone are not enough. The strategy must be backed by a robust funding framework. While the UK and the US dedicate around 15 and 30% respectively of their official development assistance to health, the EU lags behind at around 5%. The ambitions of the new strategy needs to be mirrored by a scale-up of global health funding across programmes. For example, through a much-needed increase of research and innovation investments under Horizon Europe to global health initiatives such as CEPI and collaborative research to feed the pipeline of poverty-related and neglected disease R&D candidates for further development under EDCTP 3. And under the EU's Development Cooperation Instrument, NDICI, health needs to be prioritised through bilateral funding to partner countries and via support to multilateral initiatives such as UNFPA supplies. For both these partnerships, CEPI and UNFPA supplies, the EU's contribution remains lower than it should. In this context, the midterm review next year of the EU's long-term budget, the MFF, is a crucial time to put the ambitions of the new strategy to the test. Without a refreshed MFF with additional funding for global health, the EU's capability to address and prevent ongoing and future global crises will be restrained. As a final point, we'd like to discuss the implementation, engagement, and accountability of the strategy. To be impactful, it must translate its commitments and principles into concrete actions. The strategy must be underpinned by an implementation plan, accompanied by a robust monitoring and evaluation framework with measurable, relevant indicators allowing for regular reporting on progress. Local CSOs and communities, citizens, young people, parliamentarians are essential for the successful design and implementation of health programmes and strategies. In implementing this strategy, regular dialogues with civil society and other stakeholders, both at political and technical level, will be essential for transforming advocacy into policy and, most importantly, policy into impact. Thanks.
Thank you very much. Thank you very much for bringing your light on the process, especially, and the issues. And I mentioned also global health advocate. That is also part of this initiative. And also we have the European Foundation Network, FILEA. FILEA is a member of this initiative. Before opening the floor for reaction, I will invite our two ambassadors to react. So we will start first with you, Stéphanie Sédou, who is the French ambassador for global health.
Merci beaucoup, Benoit. Thank you very much. Well, this was such an exciting panel. I don't even know where to start. But what struck me really is that I think the case really has been made with all your different voices, including come from different continents outside of Europe. You didn't speak with one voice. There were multiple voices, but all these voices are in tune, and we are beginning to see what could be the actual, final chorus melody that we can start playing possibly. And that, which I heard, is this notion of the one global health for all is definitely a concept which I heard emerging from what you all said. And maybe to illustrate, I found it really interesting to start with Professor Roda and how you advocated for the local and the country-specific approach to remain at the heart, that gives the One Health approach its significance, as well as for other issues such as to have relevant local epidemiological data. And this reverberated through all the other interventions which gradually built up the case. And I think Benoit, the foundation, made a great job of building up on this panel. Maybe to pick up just at this stage, and I think there will be very interesting interventions from the floor to again sort of start building up on this, is what we heard is the extent to which there is a great opportunity for Europe to play a role in global health. And I'll get back to that in just a minute, as long as it is able to seize this concept of one global health for all as a vector to overcome some of the challenges that we've heard very well laid out by Catherine, by you, John Ryan, and of course also Clemens Auer, in what we know are the current the complexity of the current European setup, which will be, which is the current job of the the Czech presidency, will be the job of the Swedish presidency, and when tomorrow, and which we experimented as the French presidency as well. But the momentum is there, and why is Europe? Why is there a chance for Europe? And I think you said it, Ole. That could be, Europe could be self-sufficient, could choose politically to go towards autonomy, or, well, you sometimes hear the French talking about sovereignty, and it's not always well understood, meaning actually autonomy, but not in an isolated way. And we make this choice politically because this is what Europe is. And many of you mentioned the values, and the values are there. The values of, indeed, solidarity, working together collectively, faith in our health being of public good that we experiment in our various countries with our various histories. And this is quite key. And I don't think, well, I mean, this sort of singles Europe out, I believe, as an ensemble, a political ensemble, which is able to build on these values. Now we have to, of course, overcome some of the contradictions we have. And Minister Molina, you mentioned, obviously, the IP discussion. So this is also something which has to be factored into the discussion. But basically, leaving it there, that there is a chance for Europe because of its particular vision of health embedded in its values, to play a role, as long as it is able to overcome the very many challenges that were laid out. And definitely the one global health for all concept could definitely be a vector to move forward in that direction. So at this stage, these are my takeaways. And I believe that the civil society angle is absolutely key in this, which was brought about by this initiative, and your voice was very strong at the very end. I think this has to be definitely it's definitely a lever that has to be used in order to progress towards the common goal. So thank you very much.
Thank you, Stephanie. And I must confess that you were at first inviting us a few months before the EU presidency to react through the One Sustainable Health Forum, and it's what we have done. I will now invite Anders Nordström from the Swedish government as an ambassador for global health to react also.
No, thank you. And extremely useful and interesting to listen to all the comments. Couple of reflections, plus also sharing a couple of things in terms of how we, from the Swedish side, now prepared for the presidency then that will start next year, taking over them from Czech Republic. And we also have been in very close contact with Spain as you started this early this year, but also speaking to Spain that will take over after us. The present EU strategy for global health, it's actually dated back to 2010. It was a strategy based on, at that time, the Millennium Development Goals. I would say that what the European Union with its member states actually did at that time was very important, because we've seen huge progress since then when it came to what was then in that agenda at that time. But the world has changed. So at that time, we had one MDG about maternal mortality, one child mortality, and the 3 diseases. We had 20 million people dying at that time. Today, we have less than 10. Big improvements, but still an unfinished agenda. But on the same time today, we have 16 million people dying from non-communicable diseases before the age of 70. They shouldn't die. And 85% of those are dying in low and middle income countries. So that is changing our agenda. What do we need to address in terms of global health? So looking forward, and I don't know what will be in the strategy, that's the Commission working on that, but we have provided inputs. And from our side, we believe that this strategy needs now to be something completely different when it comes to the content. We have had a pandemic. The strategy needs to address how we will be able now to have a more safe world, how we can prepare, but also respond in a better way. First component. Second component, we need to continue the work of enabling access to basic health service for everybody, regardless of ability to pay, universal health coverage. And the third one is also we need to invest much more, as John was saying, also in the preventive work. Possibly the most important factor for people's health is what we eat. And there are clear linkages here in terms of how we also mitigate the negative impacts on climate change. The same thing we need to do for the climate is also very good for people's health, especially when it comes to sustainable food systems. So 3 pillars, and you will, who knows WHO, recognize that those are the 3 pillars of WHO. And we believe that those are very useful to be able now to tell a different story than what we did in 2010. And that is the world of today. So that is the first change that we hope to see. The second change is a change in terms of how we will implement, how we will do this. The old strategy was based on an aid paradigm. Today, we are in a different world. Some of you were there yesterday evening, listening to John Nkasango, the one who basically built up the African CDC. And he spoke about also the importance of global health. But we need now partnerships, not just, as somebody was saying, empowering. This is no longer about helping. It's no longer even about empowering. This is about interdependence. We are dependent on the rest of the world, what is happening there. We need partnerships on an equal footing, respectful partnerships. African Union, European Union working together, but quite a different way than what we did in the past. Same thing when it comes to the financing. If we're going to finance now what is needed to be done from the European side, of course, aid is still important, but that's not going to be enough. What we're going to do on the research side, the Horizon 2020, the continuation of that, what do we do with the other instruments that we have for climate, that we have for trade? Is it going to be extremely important for the implementation? So the paradigm here, moving away from the focus MDGs, the aid paradigm, to a broader agenda with also a different way of actually relating and working together. Swedish presidency, we are now waiting for the Commission to present the strategy, the communique from the Commission. We are ready, we're getting ready now to see how we can support this now politically by also ensuring that we get Council conclusions agreed during our presidency. It's the Commission's mandate, role and task to present the strategy, but it's up to us, member states, to see how we will then basically support it or not support it, depending on the content. But most importantly, also providing a political support for the implementation. And that we are now beginning to think about and to work on what should be in those council conclusions. And we hope that we will be able to negotiate them during then the first year of half of next year. But that is not going to be enough, and that is not the only thing we're going to do during our presidency. We would like to reach out. We already now mapping that there will be a high level, of course, continued dialogue in between EU and the AU in May. I hope that health will be on that agenda, and we can use that as an opportunity now to have a conversation in between what has happened now in the African region, enormous more of capacity, political will, and the same thing from the EU. So then, as John was saying yesterday, global health, for some people are seeing sort of global health top down, sort of, no, that's not what global health is for me. It's about stronger regional capacity, stronger national capacity, but we still have to work together at a global level. And that we need to talk about. And I think that's one opportunity. We're looking forward to an opportunity, the same thing with the US government. I know that Spain is planning the same thing then with the Latin Americas when they will take over their presidency. That will happen later on during next year. But we will also try to find opportunities to engage with private sector, with civil society. We are hosting a number of meetings in Stockholm during this year. Ole Petter is hosting one on the 9th of February at the Karolinska Institute. We will have a meeting on AMR, etc. Plus, we will, of course, do sort of work on the legislation that was mentioned here. That's part of our Minister of Health priorities. But we will also engage beyond Geneva and Brussels in New York. The high-level meeting to follow up on the UHC, but now also the decision to hold a high-level meeting on pandemic preparedness and response. We will definitely do our utmost to support that high-level meeting also to be successful. Hopefully that good political declaration will be possible to negotiate. I will end a little bit sort of what Stephanie said in terms of singing the same song. One voice from the EU, that would be a good thing.
but it will be even better if we have a choir of voices that are singing across the world the same song. Thank you.
Thank you to our ambassador for the reaction. We are going now to take some questions from the floor. So I will ask you to introduce you shortly and to raise a question. So I see several hands. So a lot of real motivation. So you need to join the coalition. Luisa is going to, yes.
Thanks a lot. My name is Teresa Krüger. I'm a final year medical student, and I was the former youth delegate to the World Health Assembly last year. And during the discussion, it was often mentioned that One Health is interconnected with the climate crisis. And I think when we speak about the climate crisis, we also have to speak about fossil fuels because it's a major contributor. We have to speak about oil pipelines, about gas, about coal. So I was just wondering, do fossil fuels play any role in the strategy? Thank you.
Good question. So who wants to start? Who would like to give an answer? Or we can take maybe 3 questions, you're right, because
Members, can you hear? Oh, thank you. Hi, Stefan Sportling Peterson, Karolinska Institutet. I just wanted to plug for the importance of the agriculture and the trade, because that's where the European Union spends its money. That's where it has a global footprint. So what can we actually do, John and others, to make sure that that features prominently in this strategy so we don't deal with the consequences, but the roots?
good question. I guess John will have maybe some answer.
Etleva Kadili, representing UNICEF. A great outline from all the panelists, really fantastic to hear. A question, as we heard also from the Professor Roda, looking at the really local priorities. What we're seeing here is not only Ebola, we're seeing also polio being back, not only in low-income countries, but also in high-income countries. We're also seeing monkeypox, unprecedented cholera outbreaks like never before. Are we also looking at the access to clean water as part of global health strategy? And second question is with regards to risk sharing with private sector with regards to preparedness and response. Thank you.
Thank you. So maybe we can start to answer to these 3 questions, more or less. So John, I will invite you maybe to say a few words, and just maybe Roda.
Just a few words. So what strikes me about all of these questions is really the link between having solid internal and solid external policies. And I think there is a need to have a link between the two, because for the simple reason that many of the tools which we have, the legislative tools which we have, are based on our internal powers. So in other words, if you don't have strong legislation on pharmaceutical development, if you don't have strong cooperation on research, if you don't have clear objectives which are health friendly in the common agricultural policy, it's very difficult to have something which is stronger on the external stage than you have on the internal stage. So that's the first key point I'd like to make, that when you're developing these internal policies, whether it's farm to fork, reforming the common agricultural policy, digital Europe, EU for health, the European Health Union on cross-border threats, this is really essential in order to have a strong position to project together at the international level. Many, many years ago, I was working on tobacco, and I was working on the original tobacco directives, if any of you remember. And it was a major battle, but actually having our strong legislation enabled us then to go to Geneva and to negotiate the International Tobacco Control Convention. It's a very good example, really, because it shows that whatever you have at the national level can then be, or at the European level, can then be projected internationally. So I think it's really important that we make this link, and that when we're reforming our internal policies on whatever subject, whether it's fossil fuels, climate change, whether it's health workforce, whatever the subject might be, it does have a clear international mirror image, which we then have to reflect on the multilateral level. And you shouldn't forget either, I'm not just talking about legislation here, I'm talking about trade negotiations, for example, treaties. So that when we have a clear position, a clear direction in our internal policies, it's much, much easier then to project that as a negotiating position internationally, and not to have the opposite approach internationally that we have internally. So it's this coherence between what we do at the European Union level and at the international level, which is really important. There was a reference question from UNICEF on the access to clean water. I don't think the global health strategy, and again, I'm not going to give away the details here today, but I don't think it will go into that level of detail. I think what I will try to do is to establish a link between international targets, such as the SDGs, the activities of the international organizations, and the European Union support for those activities. So that will be the key message. And, you know, as I said before, on agriculture, trade, on fossil fuels, all of these, we have strong domestic positions, and the ambition will be to make sure that those are translated at the international level.
Thank you, John. Yes, we know the chemical pollution in the water, for example, that are the big issues. Someone else want to add something according to the question? Michelle? No? Oh, it's okay. So we are going to welcome other comments and questions. Andrea?
Yeah, so it's on. Thank you. No, well, thank you very much to the panel. Excellent. So Benoit, Detlef, Ole Petter, and Rhoda for the co-organization, for the great comments and great deliberations. Andrea Winkler, Lancet One Health Commission. I just wanted to make 3 comments. So one is, I think, and I know we shouldn't actually talk about concepts anymore. We need to talk about implementation and impact. But I really liked what Fayon, if that's the right pronunciation, said. We have 2 sort of global health and One Health, and it's a bit intermingled at times. And One Health means different things for different people, as you also very rightly, John, you very rightly pointed out. So what you said, I think global health with a firmly embedded One Health, I feel really is our, or should be our common denominator, which is great. So that's just a comment. And also to follow what Anders and Stephanie said, especially Anders, I think you mentioned here for the first time, the non-communicable diseases. And it's so important to really, we talk a lot about surveillance, which is great, and the AMR and emerging diseases, but the non-communicable diseases that are intertwined and connected to all of this, but also bear the highest burden, need somehow to be fitted within global health, but also One Health. And last but not least, Ole Petter, I love your Cs. Whenever you come with your Cs, I listen very closely. I would like to add communication, and not the least capacity building. And I think this is what we talk about here, is the infrastructure establishment so that we can create impact, because we need to move to impact creation. Thank you very much. Chris, you're next.
Thank you, Andrea.
Okay.
So you're also a great member of the OSH Forum, and I see also Professor Babette Simon, who is with us.
Okay, I'm Billy Dohan from the Université Paris-Saclay, and I'm a part of the UGLO Alliance, which is a UGLO University Alliance that gather 9 universities from 8 countries in Europe. And we are working on global health concretely. So we have 3 actions. The first action is building the education for the future. And for that, we are building a referential or competencies that enable people to be trained according to soft skills, what you said about empathy, well-being, and so all the competencies we need for the future. So we have students that are very well known about the consciousness of sustainable development and so on. So the second thing is that we are creating an ecosystem with researchers, civil societies, companies, and the students and the trainers. So this is concrete project 2. So I will present the ground truths. My third question is in relation with what you said, how can we build together? How can we communicate in our action in order to scale up these actions and to have an impact in the global health? But before we in Europe, because we are, but in the international, in the world. And for me, from my experience, it comes to the changing of the mindset. We have to be to have confidence. We have to build project together, and we have to transform the defiance into confidence and together and working together. So what are the solutions to work with you, and what are the indicators we can have to make sure that the situation will evolve optimistically? Thank you.
Thank you. So I would like maybe, Michel, due to your experience when you set up, you were the first director to manage a global fund 2 decades ago. So maybe an answer. How did you do that? Because it was not easy at the time to face this pandemic.
Well, it's not the it's the members. It's a coalition that brought it together. A coalition of member states, civil society, UN organization, private sector. I think that was the innovative process. This is why, you know, a coalition like the one we're discussing today is of I think, huge relevance. If I just can keep the microphone for a second, I'd like to come back to what Andrea said. Well, first, I think it's not too difficult to fit in non-communicable diseases if we define global health as health issues that relate to our interdependence and to the global determinants of health. And second, I'd like to reiterate my call for moving to a request for a joint action. You were talking about capacity, about communication. Dr. Ben-Simon also mentioned we need that, and there is an instrument in Europe that can provide this. We missed the 2023 budget opportunity. We have now to look at the 2024 budget opportunity. But again, let's try and do it. That will really strengthen our European capacity in global health.
Thank you, Michel. So we can take 2 more questions, and then the co-chair will close, because I have a signal. We have 4 minutes, so very short. I'm sorry, but we can keep in touch after, or we can, when they will close, I propose if you want to stay, we can follow between us, okay? So 2 questions. Mr. You were asking. Yeah. Sorry, yeah, and after.
Yeah, Chris Walzer.
Chris
Walzer from Wildlife Conservation Society. Benoit, thanks very much, and to everyone on the panel. I want to keep this really short. The word environment was basically never used. At its most basic, the 3 pillars of One Health is animal, human, and environmental health. You need to integrate the environment. And obviously, that's been noticed by others. We really need to up the game. Talking about sustainable food production and red meat and all the rest of it, agriculture and food production is one of the major causes of environmental destruction and land use change, which obviously in our interlinked crisis of global climate change, public health, and global inequities, they're all tied together. You can't ignore it. Thank you.
Thank you, Chris. So I have a signal. We have maybe you very short if possible, and then I will give the floor to Rhoda and Peter to come.
Hello. Oh, yes. So what I wanted to say was basically said by my friend over here.
Yes.
How the environmental dimension has to be integrated into One Health. I'm from the UN Environment Program. During the EU public consultation, actually, these are the things that we have provided. So one thing I just want to say, in terms of COVID or other emerging diseases, just like in the sphere of public health, you focus on the needs, the immediate needs. And we need to do exactly the same in terms of preventing at source. Where is all this stuff coming from? Okay. So you need to look at biodiversity loss, land degradation,
They are going
climate
to cut,
change, and so on.
I can reassure you, because the Forum One Sustainable Health Integrate at All, Chris, you are a founding member also, you know that, but we forgot maybe to mention it, but it's somehow an evidence. Now they are going to conclude very short, Rhoda and Ole Peter. I would like to thank those who are managing, organizing Savannah Faircloth, the foundations that are supporting also this coalition, especially the Fondation Bouloukian, Fondation Enmus, and the Fondation de l'Avenir. Now it's your turn, very short, Rhoda, Ole Peter.
Thank you. I'll just say maybe 3 words, because it looks like we are all on the same page that this must move beyond a concept to action. And if I could borrow some of the words that you've all said, I see that we have an inclusive coalition for action, and nothing can beat that. So I think we will get there, and we will integrate the environment. We will speak more about that. I see the concern about emphasizing the human and animal and not the environment sufficiently, but an inclusive coalition for action is the takeaway for me. Thank you so much.
Thank you, Rhoda. We take it because I see Goran also. It will be integrated in our mission statement. You're fully right.
Yeah. But environment and planetary health is already integrated. And if you remember the 4 C's, when we talk about context, we say quite clearly that you cannot discuss human health without taking into account what we are doing currently with the planetary health and the environment. So, I mean, this is firmly embedded in this strategy. If I may, Andrea Winkler came up with a very important question, I think, and that has to do with the need for capacity building, obviously, another C. But again, this is part of the cooperation strategy that we have. Of course, the cooperation must be forward-looking, must not be based on what we are doing here and now, but based on building preparedness for tomorrow and for a new pandemic that might easily come up rather soon. In fact, what I think is missing from the rhetoric very often is the long-term perspective. Because if you look at, for example, universal health coverage, it is not really taking into account the time dimension properly, I think. So what we have been discussing in this initiative is the need to focus much more on preparedness, perhaps talking more about universal preparedness for health, ensuring that preparedness comes to the benefit of all socioeconomic strata, all countries, and also that we have a fair distribution of, well, capacities in the world, so that next time around vaccines can be produced not only in rich countries, but also in those that really face the problems during a pandemic. So universal preparedness for health, I think, is a key concept that we should ensure is being followed up in this strategy. My final comment, and that is perhaps a very sensitive one, perhaps we could say that it's the elephant in the room, because I would like to go back to what Michel said, that states jealously guard their own competence. And I think Anders touched upon this as well. And when we look at Karin's slides about how in the USA, one has not a fragmented policy, a fragmented research system like the one we have in Europe. They have a much more concerted effort. I'm not saying we should emulate the US, but we should ensure that this elephant in the room, how we tackle the potential conflict between the national level and the EU level, that these points are taken seriously and debated. This is going to be a tough ride if we don't really face these problems, face these issues and discuss them openly. So thank you for your attention.
So I would like to thank all the speakers, the ambassadors and new participants. And if I may, give the floor to Detlef Ganten, because without you, we didn't start. Yes, I think it's very important. And to say that you are invited tomorrow at 2 p.m. We have a side event to follow how to build European Health Union. Okay, so you're welcome. Detlef.
Benoit wrote me a mail. I should say a final word. I said, no, I won't. But now since I have the microphone, I think the real challenge in the health area and in other areas of politics, health is one area of politics. The security area, peace and justice is another one. And there are many others, as you know. Overcoming complexity of the global world. That is the problem. And these are institutions, organizations, we mentioned that yesterday, but it's the trust of people, It's the engagement of people. Sometimes one person, as we all know, in one country or around the world can not change the world forever, but can have major impact. So these meetings, I think, should stimulate us to see who is the person with the charisma for not forever, but for time being, for a certain problem, can move things, and we will support him. That's my message. Go ahead, and organizations have to come together, people have to come together, but then people have to harmonize and agree on a common goal. Overcome complexity by simplicity. That is actually what Albert Einstein did in physics. He didn't understand E equals m times square c square. He did not understand that, but he had a formula, and Einstein stood for it. And he influenced science with many others for a long time, still does. Okay, so that is something we should think about, and with this, go for lunch.
Thank you, Detlef. And you can follow on LinkedIn the coalition if you need it. Please register, and of course we integrate environment, of course.